welcome to another edition of Dramatic Readings of Prior Authorizations. I had finished this whole thing and then realized I accidentally said the patient's name, so now I have to re-record the whole thing. Anyway, I had to do a prior authorization, followed by an appeal, followed by a peer-to-peer for a medication called Tymlos, which is a medication that we use for osteoporosis that encourages bone growth. For osteoporosis, there's two kinds of medications. There are the ones that prevent bone loss, and there are the ones that encourage bone growth. We generally reserve the ones for bone growth for people with fairly severe osteoporosis. Now, my patient is 53 years old. She is young, and she has a family history of osteoporosis, and she has fairly severe osteoporosis, so I wanted her to be on a medication to encourage bone growth because, well, for a couple of reasons. One, I think it's always better to build up bone and then protect what you build instead of just trying to prevent further bone loss and waiting for your body to naturally build more bone. And secondly, the medications that we commonly use, the bisphosphonates, which are medications like Boniva and Fosamax, we generally don't want to lose for very long periods of time because that increases the risk of what's called an atypical femoral fracture, the risk of complications if you take them for too long. The other option is a medication called Prolia, which you cannot stop without adding another medication, without starting another medication. Otherwise, it increases the risk of vertebral fractures. And at 53, I felt I did not want her to be committed to taking a medication for the next 20, 30 years. I thought she would do best on Tymlos. So I prescribed it, and not surprisingly, I needed to do a prior authorization, which I was okay with. I understood that. However, of course, it was denied. And this is what they said. Per your health plan's criteria, this drug is covered if you meet the following. Number 1, you have a history of low trauma, fracture of the hip, spine, upper arm bone, pelvis, or wrist. Or you have tried or cannot use a drug that helps with osteoporosis, like alendronate, risedronate, zoledronic acid, which are the bisphosphonates, and Prolia. The information provided does not show that you meet the criteria listed above. Please speak with your doctor about your options, reviewed by BT-MD. BT did not have the cojones to put his full name, but that is okay. So I appealed, and once again, it was denied. So in their denial letter, they say that you must have one of the following, either osteoporosis or osteopenia, so she has osteoporosis, and one of the following, a T-score, which is from the bone density test, less than negative 2.5, and hers was negative 2.9, so she met that criteria. And one of the following, a low trauma hip fracture, a low trauma fracture of the hip, spine, upper arm bone, pelvis, or forearm, and you tried or cannot use a drug that is used for osteoporosis treatment, which we already know she does not meet. So they denied the prior authorization, they denied the appeal, and I was thinking, well, I guess I'm just going to have to put her on a bisphosphonate or maybe do Prolia. And I thought about it and I said, it's not right. It's not the right drug for her. It's not the most medically appropriate drug for her. So I asked for a peer-to-peer. Means that I called the insurance company or the PBM, and they asked me when I'm available. So I gave them the hours that I'm available, including, and I said they could call me after hours if necessary. I gave them my cell phone number. Here's the thing, because they don't make an appointment. They ask the reviewer to call you, and you don't know when they're going to call. So I didn't want to give them the office number in case they're going to call me after hours or when I wasn't sitting in the office or the phone was busy. So I gave them my cell phone number. And they said, okay, it might take 2 weeks. Fortunately, it only took, I think, 5 or 6 days for the doctor to call me. And lo and behold, it was an endocrinologist. It was an actual peer. Because trust me, I've done peer-to-peers where I've had to talk to an ENT about an insulin pump. And I've talked to family medicine doctors. I think I've talked to a pediatrician. So it was a relief to know that I was talking to somebody who understood where I was coming from. So I gave him the whole rationale that I gave you in the beginning of this video, and he said he gets it. He understands. Unfortunately, he needs to bring something back to the insurance company because they do have their criteria, and so he needs something to back him up. So he asked me to calculate her fracture risk. There is a calculator tool that we use to determine what the risk is of somebody developing either a hip fracture or other fractures. What you usually don't compute if someone has osteoporosis, because osteoporosis by itself is enough reason for treatment. We often will use the calculator for someone who has osteopenia because someone can have, bone loss that doesn't meet the criteria of osteoporosis, but is still a significant risk of fracture, either because they have a family history of fracture or they take corticosteroids or whatever. But he said if her risk of fracture is really significantly high, then at least he has something that he can go back to the insurance company with. And of course, her risk is high. So he said he couldn't promise me anything because all he can do is present the case to whoever does the approval and recommend approval. And he said, but he couldn't promise anything. He said it doesn't work for the insurance company. He is an independent consultant. Okay. Thank God. Tymlos was eventually approved. Now, this whole thing took about 6 weeks. I am glad that the Tymlos got approved. I'm glad that I talked to somebody who was willing to hear me out and help me to get this approved for my patient. I'm glad I didn't give up. Speaking of not giving up, if and when TikTok disappears, you know where to find me. Links in my bio. I'm going to put this there too.